Many amputees will tell you that they feel an ongoing painful sensation coming from a limb that's no longer there. The limb itself may be gone, but the pain is real. This is called phantom limb pain. Is PLP more common in upper or lower limb amputees? It is more common in upper limb amputees than lower limb amputees, and is also more common in females than males. How long after surgery does it take for these symptoms to manifest? Some will feel PLP immediately after the surgery, while for others it might develop months or even years later. It was first thought to be a kind of psychological disorder, but new studies show that there is actually a neurological reason for this phantom limb pain. Cortical reorganization is the term given to the most common explanation of PLP. This is also called neuroplasticity. Neuroplasticity, as defined by MedicineNet, is the brain's ability to reorganize itself by forming new neural connections throughout life. It allows the neurons in the brain to compensate for injury and disease and to adjust their activities in response. Cortical reorganization, or neuroplasticity, is what I'm going to describe in the next section. Nociceptive nerve cells give the brain information about pain, while proprioceptive nerve cells give the brain information about where the limb is in space. When areas in the somatosensory cortex that used to represent the amputated limb stop receiving signals from the nerve cells there, the brain gets confused. The somatosensory cortex in the brain is where these signals would usually go to, but since the limb is missing, there is an absence of both proprioceptive and nociceptive signals coming back to the brain from that region. So other neighboring areas in the somatosensory cortex began to take over the area that had once received the amputated limb signals. Ramachandran, who is the leading scientist in this field of study, has done studies to prove the correlation between areas of stimulation from the face to the phantom limb in hand and arm amputees. The sensory input from the face takes over what used to be the hand's cortical strip in the somatosensory cortex, so that when a certain part of the face is touched, the amputee feels the sensation in the phantom as well. These sensory referrals actually have a specific map that is generally the same for all amputees. Many amputees will tell you that they feel an itching, cramping, burning, or shooting pain in the phantom limb. There is no specific age of onset, as it just depends on when your limb was amputated. The pains vary for each amputee. Some may occur frequently, while for others they might be a rare occurrence. Sometimes the pain may last for a couple minutes, or for a couple hours. PLP is not something that kills people. In fact, it's a reminder that you're a survivor, if anything. Usually, the people who feel PLP are war veterans who have had some kind of irrevocable damage to a certain body part, or people with peripheral arterial disease, which is poor circulation because of damaged or narrowing arteries, which kills off tissue and causes infection. There are no for sure treatments for PLP, but there is a certain mirror box treatment where the patient will stick their good hand, or whatever limb it is that's been amputated, into a box on one side of a mirror and the stump into the other side. When the patient looks at the mirror and flexes their hand, it looks like their missing limb is back and moving. Usually amputees will say that their missing limbs are constantly stuck in an awkward or painful position, and using this technique greatly relieves that pain by tricking the brain into thinking that the missing limb has moved out of the uncomfortable position it had been paralyzed in. The first interesting fact I found was that amputees have varying degrees of control over their phantom limb. Sometimes they can move it with a great deal of concentration, while other times they can't move it at all. The second fact is that 41,000 out of 7 million British soldiers in World War I had amputations, and usually they were performed with guillotines. My third and last fact is that there are about 1.8 million amputees today in the US alone, and not 70. But 80% of them report feeling phantom limb pain, which is why it's important that we keep researching cures, or at least treatments, for PLP.